So my guest today is a friend of the show. He specialises in treating people with anxiety disorders, and he's a psychologist at the Anxiety and Stress Reduction Centre in Seattle. Dr. Travis Osborne, welcome to the show.
Hi, thanks for having me back.
So today we are covering social anxiety disorder.
That's correct.
So I suppose some of it says it in the title, it's to be anxious socially, but just so that we can get clear, what are some of the key indicators for someone having social anxiety disorder? What is it?
Yeah, so like you said, the name is one of the few names we have in psychology that's pretty straightforward. So social anxiety disorder used to be called social phobia, so people might be familiar with that term. The name recently got changed. And what essentially it involves is when people feel a lot of fear or excessive anxiety or worry in a broad range of social situations. So this is everything from meeting new people, maybe interacting with coworkers or fellow peers at school, having to get up in front of people and actually give a talk or speak in front of a group of people. So this is really kind of a kind of broad-based fear or anxiety in social situations. And one of the key features of social anxiety disorder is that people have a lot of worries that people are going to evaluate them negatively. So they might have a lot of thoughts like, these people are going to find me uninteresting, or I won't know what to say, or I'm going to look stupid, or they'll think I'm boring or awkward. And so there's a lot of self-talk happening where people are kind of what we call mind reading, where they're expecting that they know what other people are thinking of them and assuming that it's very negative. So
what would mark the difference between this and someone that's just maybe a bit shy?
Yeah, that's a great question. When we have people come in for treatment, that's one of the questions people are often trying to sort out. So shyness is actually a really common trait. There's a lot of people in the world who are shy or who are reserved, who maybe just feel less comfortable or less at ease in social situations. And what we know is that the majority of people who are shy actually don't meet what we would call the criteria for social anxiety disorder. And one of the things that we look for to help us determine that is to what extent does the shyness or the discomfort in social situations actually lead to impairment in their life? So, for example, does it prevent them from developing friendships? Does it prevent them from dating or having romantic relationships? Does it get in the way of them being able to do their job or to do school successfully? And if it doesn't interfere with those things, then we sort of see that as falling in the camp of more normal shyness, or maybe what we also call sometimes being introverted or more reserved. But when it's really starting to prevent people from living life in the way that they want to, that's when it kind of tips the scales over into social anxiety disorder.
So what would be some of the kind of ways in which it would affect someone's life on a day-to-day basis that you would be looking at?
Yeah. So just as with all other types of anxiety, social anxiety can range from pretty mild to pretty severe. On the mild end, what this might look like is people who, when they're introduced to new people, feel pretty anxious and maybe try to get out of those situations pretty quickly, and kind of say hi and kind of remove themselves as much as they can. Or if they're, let's say, have to speak in a meeting, let's say someone asks them their opinion in a meeting, they give a very brief answer, don't elaborate, and try to kind of move the conversation along to someone else. On a more moderate to severe level, we start seeing a lot of avoidance of social situations. So these might be people who would just flat out avoid going to social events, going to parties, for example. They might actually avoid opportunities at work or at school that would be good for them, for their education or career, but it would mean that they would have to speak in front of other people, either like in a classroom or a formal setting. A really common thing is like in a school setting, people like never raising their hand to ask questions, feeling a lot of anxiety and embarrassment about even going up to a professor, let's say, after class to get help. So this can, over years, cause really profound impacts on people's lives. And in really severe cases, it can prevent people from developing friendships. People can be extremely isolated. It can certainly interfere with any kind of romantic or dating life, and can really block people from reaching, a lot of the basic goals that we all have in life.
So if somebody's listening and maybe they're thinking, oh, well, I do a bit of that, where would they start in trying to deal with this and trying to kind of break free from it?
Mm-hmm. Well, I think, as with all types of anxiety, it's kind of important for people to be aware of what the treatment options are, and then to talk about what part of that treatment people can do on their own if they're not ready to actually seek professional help. As with other types of anxiety that we've discussed, there's certainly medication is one option that people find helpful. What's interesting with social anxiety is there's kind of two kinds of medication people should be aware about. The first is the SSRI medications or antidepressants, and those can help on a broad level, just lower people's anxiety in a broad range of situations. And they're the kind of medication that you take every day, and it takes a while to build up in the body. There are some other types of medications that are very quick-acting medications that reduce anxiety within maybe 20 to 30 minutes. And what they're designed to do is kind of block the physical feelings of anxiety that people feel in social situations, like maybe their heart beating, breathing more quickly, sweating, those kind of things. Those kind of medications, there's two types. One are called beta blockers and one are called benzodiazepines. Those are usually used in situations like, let's say someone has to give a public talk at work or at school. Someone might talk to their GP about getting a prescription for one of those medications so that they could take it right before that situation, just to kind of help them get through it and not feel so anxious. So there's kind of two ways to combat this from a medication standpoint. From a therapy standpoint, cognitive behavior therapy is really the most helpful type of treatment for social anxiety. And this involves two main things. One is learning how to think differently in social situations, and the other is learning how to break out of these patterns of avoidance that people start engaging in when they get really nervous in social settings.
So we've talked before on different shows about people using safety behaviours, and when you were talking there about taking the beta blockers or the benzodiazepines, would that be considered then a safety behaviour, kind of masking kind of them actually finding out that the worst case scenario doesn't happen?
Yeah, it definitely can. Those medications can certainly become a safety behavior, and they can become a safety behavior because they act so quickly. The other medications we've talked about, the SSRIs, tend not to become a safety behavior because they're really a long-acting medication that takes weeks to help. But certainly people can start to rely on those medications, and it can be kind of a crutch. Where we tend to think about using them in treatment is at the beginning stages of treatment, when someone maybe hasn't learned the coping skills yet to be able to navigate those situations well. They can be a useful tool to help people kind of meet important demands in their environment while they learn those skills. But over time, you're exactly right. Those medications can prevent people from learning that they can cope with those situations successfully. Other really common safety behaviors that people who are socially anxious often do include things like really over-preparing for social interactions before they happen. And this can look like kind of almost mapping out the conversation in advance, thinking about like, what questions am I going to ask? What am I going to say? There's this belief that if I don't really prepare, then I'm really going to kind of choke in the situation. We also see kind of the tail end version of that, which is after a social situation. Someone may spend a lot of time really kind of reviewing in their mind all the things that they said and how the other person reacted to try to look for any ways that they might have made some social mistakes or kind of faux pas. Other things would be if they're in a social situation, maybe kind of hanging back, not really talking much or interacting with people, or only talking to people that they know. A lot of people with social anxiety, a lot of adults with social anxiety will tend to drink alcohol in social situations as a way to make them feel more comfortable, is a really common safety behavior. And a really big one that we really want to help people change in treatment is that people who are socially anxious spend a lot of time observing their own behavior in social situations. And this is kind of designed to make them feel that they'll catch if they do something maybe that was socially, awkward or inappropriate. But the act of observing one's own behavior actually makes us feel more self-conscious and more anxious because we're not really paying attention to all the other things around us. So that's something we really want to help people change.
So it sounds like it's a two-pronged approach between the kind of the actual practical things of losing the avoidance and then also dealing with the thoughts. So what are some kind of common tips that you would have? I guess, is it mainly driven more initially by the thoughts and then the behaviours come into place to try and protect them?
Yeah, absolutely. So because the real anxiety kind of starts in social situations by this interpretation that other people are going to evaluate me in some negative way. And usually when we start helping people look at their thoughts, they have a pretty consistent pattern of something that they're worried about. For some people, it's that they're really worried about looking awkward. Other people are really worried about coming across as boring or uninteresting. So first we help people tune into their thoughts just to notice what is it that you're worried about that people are going to think about you. Once we know that, we can start really having people challenge their assumptions about how people view them in social situations. So, for example, a lot of people with social anxiety are really worried that they're going to kind of blank out and not know what to say in a conversation. And they'll assume that other people will interpret that as them being unintelligent or uninteresting. And what we'll do is we'll have them break that down and really look for evidence about whether or not that seems to be accurate. Losing your train of thought in conversation is just a normal part of being human. We all lose our train of thought. Kind of coming up to a dead end with someone in a conversation where maybe you don't know the person real well and you kind of run out of things to say is really normal. So part of what we do is help people understand that the things that they're so worried about are oftentimes just normal part of human interaction. And then we help them look for alternative thinking approaches that might be more useful. So, one common one would be like, I'm only responsible for 50% of the conversation, because a lot of people with social anxiety feel like they have to carry the whole thing and that it all rests on their backs. Or this idea that, running out of things to say is not the same thing as being stupid. It just means you ran out of something to say. So helping people really kind of decatastrophize and think in more helpful ways is really key.
And then in terms of if they've been avoiding things, how would they get to a place where they can start doing those things if it's been going on for a while and that they've got all the fear around it?
Yeah.
What would you advise?
Yeah, well, we often spend a fair amount of time working on the thinking part first so that people can then use those thinking strategies to start approaching social situations more confidently and with some more, coping skills. So what we would do is with other types of exposure is we would really map out what are all the different types of social situations that the person is avoiding, and then kind of ordering those from those that are kind of easiest to hardest, and then systematically helping them start to approach those. And so sometimes we start very easy with like maybe asking somebody on the street for the time, or asking somebody for directions, or maybe making a phone call for information, working up to actually then like initiating like a conversation with a stranger, a more kind of lengthy conversation. And on the high end, it might look like things like actually, attending some sort of function or social event or party. Might be asking somebody out on a date, could be having to like give a presentation at work. So we really kind of try to scale it so that we build confidence in social situations over time. And in that, we're helping people look at how do they break all the safety behaviors that they're doing. So if one safety behavior is not making eye contact, which is really common with people who are socially anxious, then we really work on people developing that comfort with that skill of maintaining eye contact, really focusing their attention on the other person and the interaction.
And so overall then, it seems like there's two things that people need to do if they're experiencing this. They need to reevaluate their thoughts and ask, well, is this really true? And look for evidence otherwise, because the problem is they're not challenging them enough at the start. And the second thing is, behaviour-wise, just start really small with things that you're scared of, even if it is going to someone in the street and saying hi, and just work your way up. And through using that, then over time, the anxiety should diminish.
Yes. So what we see with people who kind of follow this approach is that anxiety in social situations decreases significantly. And what's important for people to understand is that some people with social anxiety have really had social anxiety their whole lives. And developed it as a child, and it's continued into adulthood. And they might, reach a point where they think like, well, I've been really socially anxious for maybe 30 or 40 years. This approach, isn't going to work for me. This is for people who maybe got anxious kind of later in life, but who started out, more socially comfortable. And it's important for people to know that this approach really works for anyone, regardless of whether their social anxiety has been going on for a long time or not. And the reason for that is that the reason that social anxiety continues is because of these avoidance behaviors. And if people can learn to break out of those avoidance behaviors, it's effective regardless of how long it's been going on. The one thing I will add to that is for some people who have been socially anxious their whole lives, sometimes it has prevented them from ever developing friendships, ever developing dating relationships, developing any kind of social support network. And so sometimes conquering the social anxiety is just the first step. Then we get to the second step, which is how to help people kind of build and kind of play catch up in a way in their social life, how to start building friendships, dating and all those kinds of things. And so it's important for people to understand that if it's been going on for a long time, there might be like a two-phased approach where they first work on the anxiety and then start doing all the things that they maybe have been missing out on over time.
So really, the message is that anyone can start, and they can start doing that now.
Absolutely.
There's nothing to stop them, and it's not rocket science. It's just it might not feel comfortable doing it, but if it doesn't feel comfortable, you're probably doing it the right way.
Yes, if you're uncomfortable, you're definitely doing the right thing, because it means you're pushing yourself to do the things that scare you. And I just want to sort of remind people who maybe have not heard some of our other interviews that the key to this approaching anxious situations is really to confront the same situations over and over and over and over again. So when I gave the example of maybe asking someone on the street for directions, we wouldn't have someone do that just one time and expect that their anxiety would decrease.
That would be great.
That'd be fantastic if it did. We would have them do that 30, 40, 50, 60 times, over a period of days or weeks, until that behavior just became so comfortable that there was virtually no anxiety around it. And so that is a simple thing that people can start doing on their own to challenge themselves, if they're in the supermarket, or if they're, at the post office, or if they're, getting their morning coffee. Like, there's so many experiences that we all have every day where there's a chance to push ourselves. But it really is that repetition of doing it again and again and again and again. The other thing I just want to make sure people understand is I mentioned that safety behavior of kind of observing oneself in social situations, which makes us feel more self-conscious. A key strategy that people can start to work on, too, is pointing their direction out at other people instead of at themselves. And this is a really simple strategy that tends to make a huge difference with social anxiety. And that can be challenging to do if people are used to really monitoring themselves in social situations. So I'll sometimes give people like a suggestion to notice like the color of somebody else's eyes, or notice kind of the pattern of the clothing that somebody else is wearing, or some detail that kind of forces them to shift their attention kind of outside of themselves and onto the other person. And what most people find is they feel much less awkward and self-conscious when they're really paying attention to the other person as opposed to paying attention to themselves.
And of course, the other point of that is we were talking earlier about people being scared of having interactions and conversations and worrying about what to say. But if all their attention is focused within them, then they will find it hard what to say, because they probably haven't been listening to what the other person's been saying.
Absolutely.
So it kind of feeds into it.
Yeah, this is a great example of how social safety behavior really backfires. Because that focus on yourself not only makes you feel more awkward, it's kind of like if you really focus on walking, the act of walking starts to feel very awkward, even though we all do it automatically all day. Same thing happens with social interaction. And then if you're not really focusing out, you're not noticing people's body language, you're not noticing their facial expressions, you're not maybe hearing everything that they're saying, which makes the social interaction so much harder because you're missing all of this important information. So that's kind of a really simple tip that can really start to change the way that people feel in social situations.
Fantastic. Well, some great tips there, and the message would be just do it.
Yeah,
I guess.
Get started small, and repetition is the key.
Fantastic. Well, you'll be back very soon in the next few weeks with another interview on anxiety, and I think that will be on panic disorder.
That's correct.
So we will look forward to that. But in the meantime, thank you very much, Travis.
You're welcome. Thank you.